In the 25 years or so that I have been living with depression, people have tried a lot of different things to help me. And all of these things have come from a genuine place of wanting me to feel better. And so I can't blame people for trying to help in the ways that they have. However, not every approach has been effective, but those things that people have done to help me feel better that have worked, I wanted to distill down into a short list to help those of you out there who might be supporting someone who is living with depression. Now, this is about depression, but this might as well be about a variety of other mental health challenges to include addiction or anxiety or healing from a traumatic event, having OCD, bipolar disorder. I mean, the list is long. So really, this is a video about how to support someone who is struggling with or dealing with a mental health challenge. But because I happen to have more experience with depression, I'm going to keep this terminology around that topic. So let's jump right in. Number one, the first tip is to put love above understanding. And when I say understanding, I don't mean understanding in the empathetic way. I mean understanding in kind of the clinical or the informational way. So there is so much out there that is scientific and analytical about depression and mental health issues. And there is a deep, deep, deep rabbit hole that you can go down to learn about all the different things that contribute to things like depression, anxiety, OCD, the rest of them. And a lot of it's good to read for some context. However, you're not going to solve someone's problem, more on that later, by learning about what doctors and other professionals have said about this. So educating yourself to a point is good because you want to have the vocabulary that you need to talk about this, but it's also not something that should be placed above the want to just be there, be a friend, and to love them. So tip number one is to put love above understanding and try not to become an expert at something just because you think that that might help you relate with what they're going through, because it's not going to work. It doesn't work like that. So number two is to try not to catastrophize their future. And so what do I mean by this? So in my own life, I have known alcoholics who have succumbed to their disease. I have known people with intractable depression who have taken their own lives, sadly. And I know people who have had delusions or psychoses that have forced them into institutional care. And so it's really difficult not to think about those those fates for people in my life who might have those challenges. So tip number two is to avoid the temptation to frame someone's life for them, thinking, for example, if you have a child that is exhibiting symptoms of depression or anxiety, thinking about how their life is going to be now that they have this, and how dark and how challenging it's going to be for them to just be alive at all, when really people with a whole host of mental health challenges can go on to live very fruitful, very fulfilling, and complete lives. And I like to think I'm an example of one of those people. So number three is kind of one that's taken for granted, but I think it's worth adding to this list, which is to check in and check in often. So one of the most painful aspects of living with depression, lifelong depression, is this pervasive and persistent feeling of isolation and disconnection from my fellow human being. And one of the easiest ways that I can be lifted out of that is when someone makes the effort to reach out to me and just see how I'm doing. And this can be a very, very seemingly superficial thing to do, to just either text or call or send an email to someone who suffers from depression, just to see how they're doing. Very, very simple stuff. Now, you might not really care, like in your heart of hearts, it may not be a present thought for you to wonder how they're doing. But if you knew that asking the question would lift their spirits, then you might do it. So it's a less selfish act than it is a selfish one to reach out to someone and just check in, see how they're doing. And by the way, you can actually just say that's what you're doing when you're doing it, right? So sending a note or a text or whatever and just saying, hey, checking in on you. How are you feeling? The times in my life that has happened, um, they haven't been, there haven't been many of them, but when they have happened, I have just been elated. And I can't explain why. It's just knowing that someone out there had the thought about me enough to reach out and to genuinely ask how I'm doing. I always, 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 always feel better after that exchange, right? Number 4 is to master the art of gentle, practical help. So this could be kind of a fine line to walk because you want to help someone, but you also don't want to coddle and you don't want to be overbearing. And so I have found, or at least in my experience, it's always worked best when the advice, or not the advice, but the help that's offered is as practical as it is gentle, right? So, for example, if I'm in a room, I'm in my bedroom, and it's dark, I have the shades pulled. Coming in and throwing open those shades and saying, let's bring some light in here. That's a very harsh and abrupt way to go about doing that. So instead, maybe something like, how would you feel if I add a little bit of light to the room as you walk towards the window and motion to open the drapes, right? So that's just one example. I mean, others might be, you want me to bring you some food? Or if you like, I can help you with whatever task they might have on their plate. Or uh, if we went for a walk a little bit later today, would that feel okay? Right. So these are small sort of. They're not necessarily. You're not treating the person with kid gloves. You're not trying to kind of not break them, right? But you're also genuinely there and you want to help them, and you're also doing this in a way that allows them a way out if they choose not to accept your offer. And so if they don't, and by the way, be prepared for that. If they don't, then just simply redirect your efforts elsewhere or give them the space they need until they're in a place where they can accept the help. So be very gentle, but also very practical in the help you offer. Um, and then tip number 5 is, and this is this is very important, and it's something that I've dealt with personally quite a bit. Remember that there's not anything here to fix. Um, this is definitely going to ring truest for those out there who view depression or other mental health challenges as transient, passing phases that can be either cured or healed or fixed, when the reality is more often than not the case, right? And this is especially true for diagnosable conditions like major depressive disorder, bipolar disorder, schizoaffective disorder, other personality disorders that just don't, treatment resistant depression. Um, it is very, very difficult for these people to find ways through their challenges on their own or with medication or with whatever. But they're not they don't stand a chance of being cured. Some of them, some can be, like there are some people I've known whose veil of depression is just completely lifted with the right medication and, for that matter, the right therapy. But if you approach or you deal with someone who has depression in a way that makes it seem like you're there to fix a problem, I'm here to tell you that that approach is just not going to work, because number one, the person's going to feel broken, and they're going to feel like they're the subject of some effort to solve a problem, and it doesn't work like that. Depression, at least in my case, and in so many others cases, is something to be managed. It's not something to be solved. You can certainly mitigate the symptoms and make them less severe, but as far as fixing it or solving it, you've got to stop. If you do think that you can do this, you've got to stop thinking that you can somehow wave a wand or do the right thing or say the right thing or treat them in a way that is going to completely resolve their issues, because that's not the case. Um, and that's it. Those are the 5 tips I have. It's not a complete list, but this should give you somewhere to start to begin um, treating the person that you care about in a way that is conducive to them feeling comfortable. Um, and if you like content like this, I want to reinforce that this channel is not all about that, but it is. I am making an effort to make more content that surrounds mental health and issues related to depression, anxiety, addiction, recovery, and the like. So if you do like it, please like and subscribe. Share this video with someone who you know who is supporting with someone with depression. And if you have some other tips for what has worked for you in supporting someone with depression, put them in the comments below. As I've said before, a rising tide lifts all ships, and oftentimes the comment section is a great place for that to happen. So thank you for watching, and I'll see you in the next video. Take care.